Dr. Michael Ryan with Missouri Vein Care, answering a question, what kind of tips can I recommend to teachers going back to school to help with their leg symptoms and their vein circulation? And you may wonder why teachers. Well, teachers is a group of patients that we see quite commonly. Uh, Others include nurses, pharmacists, people working in factories. They're on their feet constantly and they can't really take a break. And that puts extra pressure on the circulation. So that's why we see so many teachers that have problems. So there's some things you can do that can help. Obviously, the fact that you're on your feet all day long is something that usually can't be prevented, and you'll have to. It's a battle you can fight hard at, but you may not win. Things you can do to help: you can avoid high heels. High heels really do cause a lot more pain, and the basis for that is very simple. When we're walking around, our feet are moving, and that contracts the muscles in the calf, and the calf muscle squeezes the leg, kind of a massage of your vein circulation, and squeezes the blood out of the leg, and that's normal circulation. When you're wearing high heels, the calf muscles don't work and the blood just sits there under pressure and causes a lot of discomfort. So high heels are out. Compression stockings will help. I usually recommend people wear something knee high. They're, for most people, a lot easier to put on and take off, and most people tolerate them. Occasionally, some people find that they dig in around their knee and they want to use something that goes above the knee. There's a variety of stocking choices out there, and you can find ones that are very comfortable. They breathe. Other things you can do is, if you're standing at the chalkboard or wherever in the classroom, find a way to move around and walk a little bit, and that helps. If you can at all sit down for a few seconds, if you can sit on a chair in front of your students, that takes a little extra pressure off the legs as well. During the day, if you can elevate your legs, if you're sitting at your desk, and you may look like you're getting cavalier and too casual, but elevating your legs is something that can really help take pressure off. Finally, one thing that does also contribute to uh, vein circulation problems is being overweight. Being overweight, the reason why it's a problem is that the stomach will put pressure on the veins in the pelvis, and that makes it much more difficult for the blood to travel from the legs up back up to the heart. And so that puts extra pressure on your circulation. So if you want to have improvement in how your legs feel, that will certainly help. And that's easier said than done. But the things I recommend for most people is to cut out um, processed food, especially high fructose corn syrup, which is notorious for causing obesity. Cut down on the carbs and start a calorie burning program. And notice I didn't say exercise, but calorie burning, which usually means walking or being active in your home or yard. Those are things that are prudent and will really help. So, Dr. Michael Ryan, answering question for teachers, what are the tips that I recommend to improve their leg symptoms and vein health as they go back to school?